First of all, as we know that Shanghai entered this classified management mode since end of March, it means the city is divided into 3 categories: closed off areas, restricted areas, and preventive areas. Ms. Shao, let me ask you first, how does it feel to be in one of these areas under such a special period of time, and how do you look at the experience that you've had so far?
First of all, thank you for having me. I am in the closed off area, which is the most severe area. And I would say it has been very tough for me and also for my friends, my neighbors in this area. And because I started working at home on March the 14th. So it's almost 40 days that we have been kept in the neighborhood. And of course, I can do my job online. I haven't stopped any academic exchanges with my friends, my colleagues, both in China and outside of China. But it still feels quite tough and difficult for all of us that in this situation,
right,
and without very clear expectation.
Specifically, what have been the biggest challenges you have met? Because we have read about, for instance, shortages of food for some time. Is that alleviated? And for some people, if you have medical conditions that you need to seek hospital care, there also seem to have been difficulties. What were your cases?
I think I myself haven't met those challenges that you have said. For the food supply, I have made the preparation. Actually, in the middle of March, I started to prepare for food. And also the government has sent several packages of food to the residents here. So the food is okay. And for those medical needs, I think the volunteers in my neighborhood, they are trying their best to help the people who need all those medicines and who need to go to hospital. But I think psychologically, because every day you read all those news, right? Those sad stories from the news media, especially about those senior people and kids, which will make I myself very uncomfortable.
Yeah, so
that's the challenge.
The psychological side of things. Rodrigo, let me go to you. What has been your experience? Is it getting better? And what has been the shared sentiment among the expat community in Shanghai?
So for my family, first of all, I want to be clear that even though the lockdown is tough, is the toughest one, it's actually my third. The first one was in Madrid. The second one was social distancing in Rio, and now in Shanghai. Even though it has been tough, even though I didn't have the chance to prepare since I am in Pudong, and the lockdown here, because it was enacted first, we were not warned that supermarkets and grocery stores would be closed off. So it was harder to prepare, so we had to procure food. But we are in a high-end compound in which we more or less can go out. Nobody does, and we try to avoid. The people who are suffering the most are the poor and the vulnerable in Shanghai, the migrant workers, the ones that have to share a room with 5 or 6 other people. For us, it has been okay, even though it has been very challenging as well. As our other guest has said, there are many challenges, and the psychological toll exists and is actually a little bit increasing over time, counterintuitively. Now that things are a little bit more predictable, we're actually finding it a little bit harder to cope with the day-to-day activities, since there is no end in sight right now.
Still, there is no end in sight at this moment. There has been indeed a lot of negative news, a lot of rumors as well, but a lot of the complaints were also substantiated by real, true case scenarios, true situations, we must say. So I want to go still to Ms. Shao. What do you think have been the causes of the chaotic situation that at least some people in Shanghai experienced? Was it a lack of preparation? Was it a lack of awareness? Was it a lack of alert? Or was it the fact that the local people are so used to getting around or living in comfortable life without sacrificing too much that they're not used to enduring hardship? Exactly what is it?
I'm not sure, but I don't agree with the final reason that you said. But for the previous several reasons, I think it's a kind of combination that that made the situation quite chaotic, and especially I think because we are now all stay in the neighborhood, which means the neighborhood, the management of the neighborhood is the critical part of our daily life, and which is a kind of a weak part in the city management previously. So a lot through my discussion with my friends around Shanghai, all of us think that the neighborhood management is the most important part in our tackling with the COVID-19. And after this round, the people in Shanghai and also the government has to pay much more attention to this level.
So that turned out to be the weakest link. Rodrigo, what is your understanding? Because we are, after all, 2 years into this pandemic. We had the horrible situation in Wuhan, but after that, you would imagine that people, those cities, especially big cities in Shenzhen, for instance, southern China, where they also had cases, but soon enough they were wiped out. How come 2 years into this pandemic, the big city of Shanghai, which was doing a stellar job in targeting isolated outbreaks, all of a sudden found itself in such a difficult situation?
So what I think happened is that exactly because the city of Shanghai was doing so well, it didn't prepare well for a worst case scenario, right? And that is a little bit of what happened. It relied on the same strategies that were working very well for these last 2 years. These targeted lockdowns, testing of everybody and close contacts. So when things got out of control, the city, instead of acting swiftly to try to make things better, they avoided a citywide lockdown as long as they could. That, in my view, was a mistake. It's a completely understandable mistake. Again, closing a city of the size of Shanghai is not a decision that should be taken lightly. But the city didn't prepare for a worst case scenario. A scenario in which they would have 10, 20,000 cases a day, and they would have to close up grocery stores. They would have to close up medical facilities, not hospitals, but a lot of clinics for a while. The city was unprepared. And that reflects on the daily life of the citizens here. Because, again, in a way, it's kind of impossible to prepare to test 25 million people over and over and over and over and over and over again, almost every day. But it seems that the worst case scenario of contingency plans were not well designed. And again, because it didn't happen anywhere else. So you know what? It's excusable in a way, but at the same time, the city could have done better in preparing for this worst case scenario.
I see, very clearly put. Professor Wu, let me go to you for your take, looking from outside, from a medical professional perspective. What is your possible analysis of the situation? What happened? What gave Shanghai this past 3 weeks of great chaos, we must say?
Well, I think, this time there are two distinct differences in the current situation and the previous intervention approach. Basically, one is that the virus is completely different. As the previous speaker mentioned, that Shanghai completely rely on the old approach in dealing with this Omicron, which is much more transmissible, has a very short incubation period, and replicates in the upper respiratory tract. So that's why the virus actually easily transmits to one person from one person to another. The second, I think what happened is, I guess, that this time when Shanghai screened people and identify a bunch of people infected with the virus, it's already been too late. It might be in the situations that there are virus circulating for an extended period. So that's why when you expand the citywide testing, you all surprisingly found that the virus has been present in various different communities. So this is one of the key difference between the Omicron and the Delta virus. The Omicron, once landed in Shanghai, then it's going to transmit very quickly. If we noticed that WHO modified its warning on how the virus was transmitted in end of last year, dealing with the Omicron, acknowledges that the COVID-19 virus actually could transmit through the aerosol, which means that the virus could transmit much more efficiently. So the traditional way of intervention or prevention may not be that effective. So I think those are the two key reasons which I can see.
I see. Still, there are questions that are left unanswered because this is not the first outbreak of the Omicron variant in a major Chinese city. It's almost in a major Chinese city, almost exactly at the same time. For instance, the city of Shanghai and Shenzhen are good comparisons because they're both important cities in China, big cities, and both reported COVID-19 cases around early March. There you see this is the trajectory of the comparison between the two cities, and Shenzhen, had a closed-off management much more swiftly, and it was able to gradually lift it earlier as well. Now the two cities are showing vast difference. On Tuesday, Shanghai had over 25,000 confirmed cases, whereas Shenzhen had none. Charles, what is your possible analysis of the differences and the possible mistakes that may have led to Shanghai's situation today?
Over the course of last 3 months, actually 6 months, I've been to Shanghai and Shenzhen a number of times, especially Shenzhen, during which there were many people from Hong Kong infected who were coming across the border. So I would have thought Shenzhen's situation should have been more dire and more complicated to handle, but it was handled very, very quickly. I think there are several factors here. From the medical side, I'm not an expert on medical issues, but I've noticed two things in terms of numbers. Shenzhen has much younger population than Shanghai. Shanghai has a much older population base. That's number one. Number two, Shanghai, the number of people who are given vaccines, especially the third shot, are much lower among those over 60 years old and older compared to China overall, and less than Beijing, less than Shenzhen. So I think that makes it more difficult for the elderly to be, easier for them to be infected. The other part about Shanghai is my trips to Shanghai 3 or 4 months ago found a real sense of, everything's okay. People were no longer wearing masks, and Shenzhen was much more serious about its mask requirements and daily life, watching out carefully and not congregating in groups. So I think the population base is different. That makes a difference as well. And then in terms of the district or the community management side, in Shenzhen, it's much younger people. Most of those who are in the 街道办, the street management committees in Shanghai, are much older people and probably less sophisticated in handling these issues.
And using new modern mobile technology probably as well.
That's right.
Yeah, we're going to take a very short break and we'll be back right after that, and we'll bring in a South Korean or Republic of Korea perspective on the story. Stay with us.
Facing the unknown is always difficult. In a world in turmoil, it's easy to lose orientation. But when the storms come, we have to see the possibilities, reinvent, find new opportunities, discover a path forward. CGTN. See the difference.
Making sense of the overwhelming wave of information means cutting through the noise to shine a light on the heart of the story and making room for new perspectives. True understanding means the ability to see events from more than one side. I'm Liu Xin, and this is The Point. Welcome back to The Point. We are joined from Seoul by Dr. Alice Hyung-Kyung Tan. She is an internist with the Ms. Medi Women's Hospital. So, Dr. Tan, thank you very much for joining us. We're still joined by Professor Zhiwei from Nanjing, Charles Liu here in the Chinese studio, and our guests from Shanghai no longer with us, but much appreciated to their insights into the story. So I want to focus on exactly what is the direction of China's COVID policy, namely the dynamic zeroing COVID policy. Professor Wu, let me go back to you. It's a huge prize, obviously, as we can see the impact of the restrictions, of the disruption to socioeconomic lives in Shanghai. Some people have strongly criticized the dynamic zeroing COVID policy, but do people really understand exactly what this policy means? Does it mean that we are going to absolutely eradicate all cases, or we are going to chase after the virus as fast as possible so that we can keep the number of cases as low as possible? Exactly how to understand this policy?
Well, I don't think that many people understand the policy. The policy basically doesn't require to completely eradicate the virus, because you can't. The policy basically is to put the virus under control and preventing it from spreading into large scale infections or into other areas. So this would basically flatten the virus curve and relieve the hospital system, healthcare system from too much pressure. So this is basically what we have been doing for quite a period. It has been very successful in dealing with Delta infection, but with the Omicron, which we realized that the virus is too transmissible. So increasingly, we have to accept the fact that we probably have to live with the virus as the situation indicates across in various different provinces and cities in China, and also in other countries as well, that we need to rethink the dynamic zero clearance policy, whether we need to conduct such a thorough citywide or population-wide screening and quarantine as well. I think the key is that we need to focus on the more vulnerable and susceptible individuals and populations. So we could concentrate our resources. So that's why it's very critical to rethink.
Dr. Tan, what has been the experience of the Republic of Korea? Because in the beginning, you also had a similar policy. You tried to wipe out the virus as much as you could, but since April 18th of last year, if I recall, you have adopted a different policy, and right now you have still quite a number of cases every day. I'm looking at, for instance, 620,000 a day in March, and the number of deaths was over 21,000. How do you look at the effect of your change of policy?
Right. I've been saying that Korea has gone from trying to crush the curve to riding the wave of Omicron. We realized that we were dealing with a different virus once there was information about its transmissibility, virulence, and just seeing how other countries were dealing or failing to deal with their surges. We realized that we needed to really push our booster vaccination campaign and concentrate on protecting the most vulnerable groups. And so we have been able to achieve a fairly high booster vaccination rate in our seniors aged 60 and over. We've even started our 4th vaccinations this last week for all people aged 60 and over. So I think that was a plan in terms of preparedness of how we were going to deal with the Omicron surge. We also had to shift our testing from PCR testing of any suspicious case to rapid antigen testing. Also, our isolation policy changed with Omicron. Instead of having everyone in monitored isolation, we allowed people who were low risk with few symptoms or no symptoms to isolate at home. And because of this, of course, we've now passed our peak. Fortunately, as you said, we did have a very difficult month of March in terms of new cases. We did have the highest number of fatalities also in March of any time in the pandemic, but we have been able to keep our case fatality ratio at 0.1%.
Okay.
And we're 15th among the countries most affected with COVID in terms of deaths per 100,000 population.
I see. Charles, now the tough question as usual for you. Is the Republic of Korea or the city of Singapore a relevant case of reference for China to rethink its policy? Is it the time now to start readjusting its policy? What is your view?
I think it's not possible. Singapore, with its very small population, and Republic of Korea is basically somewhat bigger than Shanghai. If this starts to spread into major cities in China, it will be a complete disaster in terms of healthcare facilities not being able to cover, and then also the number of deaths would be astronomical. Of course, the number of vaccinations in China has been quite high. I said in terms of Shanghai, those over 60, I think was the lowest among major cities in China. Beijing is very high, Shenzhen is very high. I don't think the economy can take an outbreak in 2 or 3 or 4 cities in China, that's major cities. It will be a complete disaster for the whole country. And also, for the economy, and for its economic and trade relations with the outside. I think it would be wise to continue to press for vaccination, including the booster shots, and then continue to stamp it out wherever you find it as quickly as possible.
As for vaccination rates, I have the latest number in a paper published by the renowned respiratory disease expert. Most recently, he said that as of February, end of February, China has vaccinated 86% of the whole population with at least 2 shots of COVID-19 vaccines, with 40% completing the 3rd dose booster shot. So to protect the vulnerable, it's still going to take time. As we know, there is this time that has to be respected between the 2nd and the 3rd shots. So Professor Wu, while China must one day reopen, when is the time and what must be done now?
I think it's critical that we promote the vaccination, and for people who have taken 2 shots, they should take the 3rd one, because if you look at the timeline, the second shot in quite a big population has been over 4 to 6 months, which means that the vaccine's protection efficacy has passed its peak. So it's very important that people are going to take the 3rd shot, and for the elderly people, for those vulnerable people, they should take a 2nd or even 3rd vaccination. So that's basically, I think it's a very critical what we need to do. The other thing is that for those people who are infected but healthy and without symptoms, we need to devise a new approach in terms of such as home quarantine.
Okay.
So that could basically release certain resources for the authority to deal with the severe cases.
Yeah. Dr. Tan, let me give you my last question. How do you look at the difference, the vast difference in terms of resources and population between China and your country? And also, how did you manage to boost the vaccination process, especially among elderly people? I give you 1 minute, 1.5 minute maximum, please.
I think communication is the key. So we identified the risk and we communicated to our public that we needed to protect our most elderly, and that's what we did. And so we have very high vaccination rates, including boosters, in our most elderly population.
What if they don't agree to it? What if they don't agree? What do you do? Right.
Right, so you find a trusted person who can communicate to them, to convince them. You show them the facts. You reason with them. As a doctor, that's my goal, and that's how I succeed, is by convincing people to do the right thing, to take care of their health and safety. And I think that's what needs to be done. In Shanghai, unfortunately, the eldest, the most vulnerable, have the lowest 3rd dose vaccination rates. And so you have to resort to very severe lockdowns to prevent high numbers of death.
Okay,
and
we have to leave it there.
I agree with our previous panelists.
Thank you, thank you. We have to leave it there. Time is running out, but many thanks to Dr. Alice Hun-Keung Tan joining us from Seoul, Charles Liu joining us from Beijing, and Dr. Zhiwei, Professor Zhiwei joining us from Nanjing.